Get Healthy Cincinnati from the Christ Hospital and these local partners.
I'm Dr. Lange with the Christ Hospital Obstetrics and Gynecology Associates. Women should start seeing an OBGYN by the time they get through puberty, or at least by the time they exit their teens. Once women enter into their 20s and 30s, they really need to be going for their routine exams every year, being concerned with not only their reproductive health, if they're planning on getting pregnant, but as well as their gynecologic health, meaning routine pap smears, routine breast exams, testing for sexually transmitted diseases. Once they enter into their 40s and their 50s, you're going to start thinking about menopause. And once you get into that age group, you need to make sure you need to get your regular mammograms. You need to start asking questions about what you can expect as your body goes through the change, and make sure that you have all the information so you can make a decision on hormonal therapy at the time. As you enter your 60s and your 70s, you're going to be really concerned about your breast health as well as your bone health. Many women suffer from osteoporosis, and they do need screening once they hit a certain age. And there's also a lot of health and lifestyle things that they can do to help them prevent osteoporosis. All women need to be concerned about their reproductive health, whether or not they plan to have children. Reproductive health actually entails a lot more than just becoming pregnant and having children. It also concerns your female reproductive organs. And in order to maintain healthiness, you need to have your routine screenings each year. You need to be educated and get screened for sexually transmitted disease. And also, as you age, you're going to want to be able to talk to your physician about menopausal symptoms and more advanced screening that's going to need to be done as you get into your menopausal years. Well, I think that having a good patient-physician relationship is really going to be beneficial to you. Someone that you feel comfortable with and can talk to with ease will better help your doctor take care of you. I think a lot of the subjects that we talk about in OBGYN are very sensitive, so if you feel comfortable talking with your physician about some of your health concerns, they're better going to be able to treat you and make you feel better. There's a lot of things that women worry about that I don't think that they should. One of the biggest things that I've seen is that women are concerned about talking about sensitive subjects with someone they don't know, or just a physician in general. They get embarrassed, or they're not sure how to ask it, or they think maybe they're the only ones. And what I try to urge people is to go ahead and say it, try to get it out there, and I guarantee you're not the first person to ask me about it. So you're not alone, and I think that's important for people to remember so that they don't feel more comfortable talking about subjects that sometimes can be a little hard to talk about. I think that women should never ignore anything that's different for them. So if you have any changes in your normal periods or your normal things that are normal for your body, and it persists for any period of time, it's something that you should discuss with the doctor. Most likely an OBGYN if it has to do with your reproductive or gynecologic health. When you talk about your gynecologic health, I think there are some important red flags that you need to make sure you bring up with your physician. One that I would emphasize would be any changes in your menstrual cycle that persists. So any irregular bleeding or extremely heavy bleeding for you. Also important, once you stop bleeding, once you hit menopause, any drop of blood that you see following that needs to be discussed with your physician. And something that's very prevalent in the community is finding changes in your breasts as well. So any new lumps or bumps that you can identify, even if you're not sure, it's something that you need to see your OBGYN about, and they can decide whether you need to go on to a different specialist to help get it taken care of. My advice for busy women who feel they don't have time to go to the doctor is to make the appointment. Once you have it on the calendar every year, you will be more inclined to follow through and make it part of your routine as you go through your life. So really just need to make the appointment.
Brought to you by the Christ Hospital, 5 WLWT, and the Inquirer.